After nearly a month of nationwide lockdown, America's pandemic response efforts are finally showing some signs of progress. In New York, the domestic epicenter of the outbreak, the number of ICU admissions has plateaued and hospitalizations are down. Which isn't to say the virus has been defeated entirely, but certainly this is the best news on mitigation advancement we've heard to date.
Thank you, doctor.
God bless you. God bless you and your family.
While many governors remain hesitant to ease shelter-in-place orders, this latest data, plus the recent publishing of new suggested guidelines by the White House for reopening, hints that the economy could be back up and running very soon. But not everyone is so eager to resume economic activity, including Trump's senior medical advisor, Dr. Anthony Fauci, who argues that easing stay-at-home orders will jeopardize public health. The debate over which course of action is appropriate for the country needs urgent resolve. And at this point, between the misinformation fed to us by scientists and the vast socioeconomic devastation, the answer is clear. We need liberation from this draconian lockdown. Now. The coronavirus narrative has been an absolute roller coaster. In late February, during an NBC interview, Dr. Fauci advised Americans that changing their everyday behaviors is unnecessary.
So, Dr. Fauci, it's Saturday morning in America. People are waking up right now with real concerns about this. They want to go to malls and movies, maybe the gym as well. Should we be changing our habits, and if so, how?
No, right now, at this moment, there is no need to change anything that you're doing on a day-by-day basis. Right now, the risk is still low, but this could change.
Apparently, that's not the only thing subject to change. On April 1st, Dr. Fauci projected as many as 200,000 U.S. deaths from coronavirus. A week later, he lowered that figure to around 60,000.
And it looks more like the 60,000 than the 100 to 200,000. But having said that, we better be careful that we don't say, okay, we're doing so well, we could pull back.
And this flip-flopping isn't limited to Dr. Fauci. Many popular media sources have been guilty of unreliable modeling through this crisis, as seen by this chart comparing popular academic estimates versus the actual trajectory we experience. But despite this trend of improved conditions, Dr. Fauci and state officials continue to caution against President Trump's May 1st reopening, citing fears of a relapse.
New Jersey Governor Phil Murphy, who also stressed putting public health before paychecks.
Any sort of an economic reopening or recovery depends first and foremost on a complete healthcare recovery. We start to get back on our feet too soon. I fear, based on the data we're looking at, that we could be throwing gasoline on the fire.
Granted, if we do open the economy, some people will be more at risk, mainly the elderly. As of April 10th, 78% of confirmed COVID-related deaths were people 65 and older, which is a staggering difference compared to the 1.2% death rate of those in their 50s and 0.3% for those younger than 40. And keep in mind that these are ratios of infected to fatality, so their accuracy depends on counting the number of infection cases, which we haven't done. Even now, the US has no random testing. You can only get a test if you have symptoms, or if you're a well-connected celebrity, which could exclude as much as 50% of the actual cases. Yes, we should take responsible measures to try and ensure the safety of our centennial class. And we've seen just that via private initiatives like increased sanitation of hands and surfaces, senior-only shopping hours at department stores, and vouchers for delivery apps. Most of us understand the effective preliminary results of social distancing. The concern lies in whether the damage caused by mandatory state quarantine is a reasonable price to pay. And the damage imposed by state governors has been damning.
Our community is struggling. We want to go back to work. We have employees. We have paychecks to issue. We have bills to pay.
The sick are being taken care of. If you're sick, stay home and in your house. The ones that can work need to work.
People are becoming more and more stressed from social isolation. Suicide rates are on the rise. More than 16 million people have lost their source of income. Parents are struggling to pay and collect child support. Domestic violence has spiked. Child abuse is rampant and unreported. Small business owners are being forced into bankruptcy. Families are separated due to travel bans. Elective surgeries for critical illnesses unrelated to COVID-19, such as cancer, are temporarily suspended. And to top it all off, families who are just trying to cope with this sudden plunder of financial and societal norms are now being fined for attending church services on Easter Sunday. It's insane. It really is. Pushing society into a state of emotional and economic ruin to protect a small demographic who themselves have the agency to voluntarily self-quarantine is not progress. And the danger of keeping Americans on lockdown is not speculative. It's clear, present, and large. Other countries around the world realize this. Austria, Denmark, Sweden, and Spain have already begun the process of reopening their economy. And many poorer countries who were already struggling to maintain basic standards of living prior to this outbreak are now learning that the Western luxury of halting economic activity isn't a sustainable option when your in-person labor is necessary to putting food on the table. Fortunately in America, most of us don't have to decide between social distancing and starvation. But the lack of empathy and ignorance regarding the torture many Americans have to endure because of these lockdown policies is despicable. David Henderson, economist and former health policy advisor under the Reagan administration, explained why these shelter-in-place orders from tyrannical governors is doing far more harm than good in keeping society healthy. In his article for AIER, Henderson wrote, quote, "If you add up all the suffering and death generated as a secondary effect of the shutdown, we're looking at carnage that could be in the same ballpark as COVID deaths. Emancipation now could in fact be the strategy for minimizing fatalities. It will certainly reduce overall social and economic disaster from the disease and the disastrous policy response." He's right. Adding more problems and anxiety to the lives of Americans doesn't counteract the already grim situation of global pandemic. If anything, it only serves to accelerate the spread of instability, depression, and chaos in communities, which we will soon realize is far scarier than the spread of this flu if we don't correct course fast. As the policy war between state and federal powers rages on, we have to come to terms with the reality that the continuation of this lockdown will only lead to further decay. There's no excuse as to why we can't forge an effective medical response in a free and open society. It's time to let capitalism resume. Time to let us wash our hands, go to work, liberate markets, and reignite human interaction. That is, right now, our best hope for survival.